How could the waste management practices in Lagos and other environmental factors within the metropolis be affecting the interventions being made to mitigate the impact of coronavirus on the population? Besides encouraging residents of the state to wash their hands at all times, as well as step up the level of their personal hygiene at all times, what is the Lagos State government doing in terms of sanitizing public spaces, including ministries, departments, and agencies, schools, recreational parks, motor parks, markets, churches, and mosques, bus stops, etc.? And do the authorities have the capacity and the political will to ensure that a functional environmental sanitation regimen is put in place to last even beyond the coronavirus outbreak? For a deeper exploration of this subject, we have here with us Dr. Muyiwa Gbadegesin, General Manager, CEO, Lagos State Waste Management Authority, LAWMA. Dr. Gbadegesin, good morning, and thank you for joining us.
Good morning. Thanks for having me.
Yes, you're welcome. But quickly, let's start with your strategy, your agency's strategy to make a contribution to this war against COVID-19 in Lagos State. I noticed on your Twitter and elsewhere that you've been carrying out the fumigation of dump sites. Why the emphasis on dump sites? Why not start with streets, neighborhoods first? What is the comprehensive strategy you have in place?
Well, we're doing all those. We put a particular emphasis on the dump sites because that's the end point of the waste management program that we have in Lagos State. Everything ends up at the dump site. And one of the first things we did at the outbreak of this epidemic was to remove scavengers from those dump sites. We were able to do that about 3 weeks ago, just to ensure that they did not become vectors for the virus, since they spend most of their time picking through trash from residents all over the state. That was one of the first steps. But beyond putting a focus on the dump sites by removing scavengers and also fumigating the dump sites, we extended our response to the streets and to households. One of the questions we kept on getting at the outset of the outbreak was that would LAWMA continue to work? And the answer is obvious. We actually have to step up our pace of work because cleanliness is probably the first line of defense against any kind of disease. You know, when we go out and we're doing advocacy, we plead with people to maintain a high level of personal hygiene, even before coronavirus. You know, personal hygiene is the first step of defense against any kind of disease. Coupled with that is environmental sanitation, meaning that you must keep your environment clean. Many of us will recall the recurrent outbreaks of Lassa fever, for example, which can be traced directly to filthy environments because that's what attracts the rats who are vectors for Lassa fever. And you know, with diseases like cholera that are traced to poor hygiene, where you don't wash your hands or you don't wash food, we know that prevention is better than cure. And that's why we've constantly preached about good personal hygiene. So therefore, when you have a pandemic like coronavirus, which is killing tens of thousands of people worldwide, you actually have to improve or increase rapidly the state of environmental sanitation because the virus did not come from the moon. It came from around us. So we need to clean up our environment, and that's what we've been doing. And that's why you notice that about a week ago, we distributed personal protective equipment to our waste handlers because we recognize that they have to stay on the front lines. So we've been able to protect over 10,000 of them. Of course, they had these equipment before, but we were able to replace those that were worn out and to give some of them who didn't have. And we've been enforcing the usage of those personal protective equipment. So we've given out things like nose mask, rubber hand gloves, soap, which is the most important material right now for washing of hands. We've also given out hand sanitizers and other materials to both our own workers who work directly with LAWMA and the employees of the private sector participators who are responsible for evacuating the trash from all the households across the state.
Now, you pointed out two things when it comes to health and sanitation. You said the first step starts with personal hygiene, then the second goes on to environmental sanitation. And I'd like us to touch a bit on personal hygiene because globally, around the world, about 2 billion people lack access to basic sanitation. Here in Nigeria, about 50 million people practice open defecation, the highest figure in the world. That's about a quarter of our population. So looking at that first step of personal hygiene and human behavioral change that we're trying to talk about, how much of that can we actually adopt when this is our reality? And how much of a threat does that really pose to our environment around us and also LAWMA's capacity to really clean up the environment?
The issue of personal hygiene poses a very high threat to the health of the people. And, you talked about open defecation. And that's a major problem. And you know that Mr. Governor Babajide Sanwo-Olu has already committed to spending about $200 million over the next few years on the issue of open defecation. This is in line with the Water, Sanitation and Hygiene Initiative, which is embedded in the Sustainable Development Goals. And LAWMA is a critical stakeholder in this process. So many of the things that you see us doing is already partial fulfillment of that pledge. And when you're talking about personal hygiene, one of the biggest issues that most people don't even think about or see is the availability of basic things like water. If you ask people to wash their hands, what if they don't even have access to clean water? So you look at the kind of expenditure that's going on across sectors. The state is spending billions to make sure that we have water flowing to households, and those are things that will be coming online in months ahead. Beyond that, we're also spending a lot on primary health care. So the primary health care centers are also being upgraded. And also the things like health insurance. The state health insurance scheme is coming online as well. So there are a range of measures that will be put in place to ensure that people have access to water and they have access to toilets. In the area of toilets, we are working with some private sector partners that are providing a variety of solutions. Many households do not even have toilets. So we need to look at ways that we can provide this critical facility so that we can put an end to open defecation.
Fallout of the lockdown in Lagos State and perhaps elsewhere is that people are going to generate a lot of waste because people are just at home, they're eating and they're generating waste. What mechanism do you have in place to ensure that these waste collectors become more efficient than ordinarily? Because I recall that I saw a waste collection truck the other day. When it entered the street, the people were very angry because every house had in front of its gate huge piles of waste which had not been collected. Do you have anything in place to monitor these waste collectors and to make sure that they also realize that at this time they're really needed to help make Lagos cleaner and more livable?
Okay, yes, we have about 250 private sector operators who have been engaged to collect waste from households. And yes, because of the recent disruption to the waste management policy of the state during the last administration, many of them, their equipment had run to ground. But the good news is that over the last 2 or 3 months alone, they've been able to acquire 40 new trucks from their own resources. And what the state government has been doing is that we subsidize their activities. The state government spends about $200 million a month just to support them, to ensure that they're able to work. And so because of this, we do monitor them closely. And we've given them this quarter to step up their pace of work, and many of them are responding. And going forward for the second quarter, those who don't respond effectively, we'll be sanctioning them very strictly. And we also appeal to residents that you can reach out to us if you have difficulties. And for this, we have a toll-free line. That's 070-80-60-10-20. You can call this number if you have disruptions in your service from the PSP operators, and we'll respond. The line is on 24/7. Let me read that out again, 070-80-60-10-20. One of the, like I mentioned earlier, one of the things we've done is we provided personal protective equipment for them. Another thing we've done is that we've rehabilitated the dump site so that they can go in and out, and their turnaround time is reduced. We've also activated the transfer loading stations, which are facilities where they can dump. They're closer to the household, so they don't need to travel all the way to the dump site. So those are additional measures we've put in place. And before the end of this year, Mr. Governor has promised that he's going to provide a working capital facility, which is a form of on-lending to support acquisition of new equipment by operators. So we believe that in the next few months, we'll be able to get to a very high level of efficiency with respect to waste collection across Lagos State.
Thank you. Now, I'd like to ask you something and seek some clarification on a particular matter. It's been rumored that there are hospitals across Lagos that have been mixing general waste with medical waste. First of all, is this true? And if so, how have LAWMA responded?
It's true. Unfortunately, you have, in any system, you're going to have people who do not comply with the appropriate regulations. Nigeria is signatory to the Basel Convention on the management of medical and hazardous materials. And LAWMA is responsible for enforcing regulations with respect to medical waste management. And 2 weeks ago, I went with my team to visit a number of hospitals in the States just to sensitize them and to see whether they were doing this properly. And we have begun the process of sanctioning and shutting down hospitals that are not complying. We're doing this along with the state agency responsible for regulating hospitals. That's the LAWMA, the Health Facility Management Agency. And we're going to go around and seal up hospitals that we find are non-compliant. And we also appeal to residents, if you do notice poor waste management practice in any health facilities, you can also report that once again through our toll-free line. That's 070-8060-1020.
Well, Dr. Gbadegesin, you've called a number now, but I also know that there is another number, and I would like you to just clarify which is the exact number, because I know you also have 08000 Corona, but the number you've been quoting since is the 070. What's the difference?
Specifically for the Corona response, the number, the toll-free line I've been quoting is for LAWMA. That's the toll-free line for anything to do with LAWMA.
Hello? Hello?
Yes, can you hear me?
Yes, you were saying that the 070 is for general operations.
That's for LAWMA operations, LAWMA enquiries, when you have issues with waste management. The line I've been quoting is specifically for LAWMA, while the line for the Corona response is 08000 Corona. That's for any Corona-related inquiry.
Okay, sometimes last year, I think it was around December last year, LAWMA said that it was going to embark on a naming and shaming project, something you refer to as the wall of shame or the hall of shame, to sanction people who do not observe clean environmental habits. Where are we with that naming and shaming project? And do you not have any concern that you could be slammed with a lot of litigation if you name and shame people for not cleaning their environment properly in your own assessment? And what's the legal basis for that attempt to name and shame people?
We don't anticipate legal challenges because everything we're doing is within the confines of the law. There's a state environmental law. So when we talk about naming and shaming, these are people who have been arrested in the act of various acts like illegal dumping of waste, like littering. And what we do is that we take them to the court. And it's after they've been convicted that they're usually sentenced to community service. Rarely will you have someone being jailed. So they're actually sentenced to community service. And it's after they've been sentenced that we now do the name and shame. And the way we've been doing it is that we take them out to carry out their sentence, and that usually involves cleaning the streets or cleaning the dump sites or the transfer loading station. And then they wear jackets that states that I am an environmental offender. And we believe that's enough shame because people can see them and see that these are people who are environmental offenders. And you could say that they're partly responsible for disease outbreaks because people who are illegally dumping hazardous waste on the streets, they are a threat to society. So I don't see any issue with naming and shaming such people. And we believe that that's a sufficient deterrent in most cases. And we've been doing that since December, and we'll continue doing it and even upscale it as much as possible. It's been quite effective.
Well, certainly, to be honest, at the end of the day, when we're talking about environmental change, if we don't name and shame, how are we eventually going to get to where we need to be? Now, I'd like to bring us back to the COVID-19 pandemic and its effects on LAWMA because, I mean, I'm sure you've had to really ramp up capacity, and LAWMA as an organization too would have faced its own challenges with this sudden outbreak in Nigeria. So what has that experience been like, especially for your employees who we're all seeing on the streets every morning, still out there fulfilling their duty?
By virtue of the kind of work we do, where we are daily coming into contact with hazardous materials, we were one of the first agencies that put in place measures to protect our staff. As far back as 3rd of March, we had already started checking temperatures of everyone who came into any of our offices or facilities, and these are spread out across the state. We take your temperature and we give you the hand sanitizer, and we also put in place hand washing basins. And then we were able to, like I mentioned, we removed people who should ordinarily not be on the dump site. Those are the scavengers, and we removed them from the scavenging sites. And then we went a step further to give additional levels of protection to the staff. So because we knew that we would have to continue working through this pandemic, we tried to protect ourselves as much as possible. Even I started taking extra precautions as well. And some of our employees, in line with the directive of the state government, are already working on remotely. We communicate via WhatsApp video or phone calls. We restricted the number of meetings. And anytime we do have to go out for monitoring or to carry out our assignments, we try to maintain social distancing. That's a minimum distance of 6 feet, 6 feet between any two people. And we also use the usual materials like nose masks, and we wash our hands frequently. So we take extra care just to ensure that we'll be able to continue, as frontline workers, we'll be able to continue rendering the critical service throughout this period.
Well, I mean, you said a lot that the Waste Management Authority is doing, but if you look around Lagos, waste disposal is still a very major problem. There may have been some improvement with collection, but waste disposal remains a problem. We see all these dump sites, some of them constituting an eyesore where they are. What is the agency doing to make sure that, you know, we modernize the waste disposal process? In other parts of the world, you have conversion. And then what are you also doing about, you know, disposal of waste into the lagoon? You know, plastics and all kinds of non-biodegradable materials.
Yes, at the last year in August, Mr. Governor launched a new initiative, which is the Sorting at Source program. The goal of that initiative is to encourage residents and businesses to separate their waste at source, to separate recyclable materials from non-recyclable materials. And with that, if we're able to achieve the objective, we'll be able to reduce the amount of waste we have to dispose in the landfill by 50%. And that's a major step. Lagos is actually the first state to start this program in Nigeria. And we believe that this is one of is the necessary first step. We can't continue dumping everything into the landfill simply because we have no more space for those landfills. Those landfills, the dump sites you mentioned, are already filled up, and we're in the process of closing them permanently. So we have to now process our waste in a more modern fashion, like you mentioned, and that starts with sorting at source. The second aspect is to look for more sustainable ways of disposing, both looking at means of, we're exploring waste-to-energy programs, we're exploring programs to process the waste into usable formats. In this, we're working with some of the major cement manufacturers to process waste into refuse-derived fuel that they can use to fire their furnaces. And that alone, we believe, should be able to take up to 30% of of the volume of waste. So that would be, if we are able to sort at source 50%, and we're able to burn up 30% through a variety of means, we'll only be left with about 20% of waste that we're going to dispose. And with this, we're working with a variety of private sector partners. The response has been quite enormous, so we're hopeful that we'll be able to modernize the waste disposal system within the next 2 to 3 years.
Well, thank you for that. And we are about to round up this conversation in just a minute. So my final question to you would be, how would you rate the federal government's efforts with regards to the fight against COVID-19? I mean, several citizens have had their complaints, shutting the borders too late, etc. What is your take on the federal government's efforts against this pandemic?
I think that the response has been okay so far. Maybe a bit slow to start at the outset, but we've been able to catch up and take the necessary steps. And in doing this, I support the way the federal government has been working in partnership with the states. They've worked effectively in partnership with Lagos State, which is as it should be. And this is because we're a federal, we run a federal system. The federal government should be working with the states in putting in place the right measures. That's the only way you can sustain those measures. And I believe that if people continue to obey the stay-at-home order and practice social distancing and all the other measures like hand washing, we'll be able to slow the spread of the virus in good time. It's still going to take a few months, so we need to really buckle down and be serious about this. This is not a joke, and we need to support the governments at various levels so that we can come through this and minimize unnecessary loss of life.
Well, thank you very much, Dr. Gbadegesin.
Thank you very much for joining us on the morning show today. Enjoy the rest of your day.